Okay, now let's talk about challenging the misinformation that is about COVID-19 and the vaccines. You've probably heard several different rumors and misinformation, such as only old or unhealthy people can get sick from COVID-19. Only old or unhealthy people die from COVID-19. These things are not true. We know that people that have chronic conditions or impaired immune systems are those at high risk from getting sick or dying, as well as the Delta variant. When that came out, it was killing many people apparently young and healthy. They don't know fully why they were getting as sick as they were and dying, but that is something that happened, and it was generally with 20 and 30-year-olds that were getting sick and dying from this. Only people who have symptoms and have tested positive can spread the virus. That's also not true. Remember when we talked about getting tested for the virus, not all people either get tested, and sometimes they're waiting 2 days, and so those people fall within the cracks that they could still be spreading the virus without knowing. There's also something known as asymptomatic spreading, that is, without symptoms, people are still able to spread the virus. You can still spread the virus after completing quarantine and isolation. So the new recommendation is that people should wear a mask for 5 days after they come out of isolation. And completing isolation includes that 5 days. So just staying home for 5 days isn't enough, but wearing a mask for another 5 days anytime you're in the public will help reduce the risk of spreading the virus. Once you no longer test positive, you are no longer sick. That's also not true. We know now with further studies that there's something called long COVID, and people are having symptoms for months, and we don't know if these symptoms will resolve completely or if they will continue causing issues. Also, there's studies out there with ivermectin. The idea of it was very valid. I think that's why it became a medication. It's cheap, it's easy. However, no medication is without risk. So there are issues with just giving medication just to prevent or treat it. And so the idea was good. However, with further studies, they found that it really doesn't help prevent or treat COVID-19. So other miscommunication or misinformation rumors, only older people and people at high risk of serious injury or serious illness should get vaccinated. This is where it comes down to the herd immunity. We want to make sure that these people are staying protected. So yes, people that are at high risk should absolutely get vaccinated, but if they're the only ones that are vaccinated, as we know, the chances of still getting sick, it's possible after getting vaccinated. It's less, but it's still possible. So if we get more people vaccinated, then it'll help protect these people that are at high risk of the serious illness. We went over the vaccine ingredients. We know that they're safe. These have been used in other vaccines in the past, and so they are considered safe. You can shed the virus, it should say virus. You can shed the virus or COVID-19 virus after being vaccinated. This is only for live virus vaccines. There are a few of them. That's not what we're discussing today. You can't shed the virus or any particle of the vaccine to other people. We discussed there's not metals in the vaccine. There are absolutely not microchips in the vaccine. That is essentially kind of a fear tactic to discourage people from getting vaccinated. It doesn't change your DNA. This is an messenger RNA vaccines. They don't even go into the area of your cell where your DNA is. The vaccine can give you COVID-19. No, the vaccine can give you symptoms that essentially is your body developing an immune system towards COVID-19, but it's not giving you the virus itself. Some people might end up testing positive after receiving the vaccine. It could be in a period of time when their immune system was low because it's trying to antibodies towards it, and then they get exposed in the public and still end up with COVID-19. That is not coming from the vaccine itself, it's coming from outside exposure. The vaccines don't affect fertility. They've done studies on pregnant women who chose to either get the vaccine or they find out that they're pregnant after they got the vaccine. So they're able to do studies and find that it's not affecting fertility. The vaccines itself does not cause variants. Variants are caused when more people get the virus and then it has a higher chance of mutating. The more people that get the vaccine, the less people get the virus, and so there's actually less chance of variants forming. Natural immunity is better than immunity from vaccination. Again, the idea is good that if you get the virus itself, that you'll have a more robust immunity towards that virus. It's a great idea. I wish it was that way, but it's not. The studies on it say that you actually get higher immunity from vaccination. Natural immunity and vaccination together currently is the best form of immunity to the disease. So this is an excellent resource that I will even be using when I help send out the newsletters monthly. But the Public Health Communication Collaborative goes through different misinformation each month. I think it's maybe even every 2 weeks. And they talk about if you should just ignore this particular rumor or how you should address it. Some of these rumors end up getting spread to many thousands of people. And so having the right information to kind of counteract those rumors and misinformation is really helpful. So the Public Health Communication Collaborative is an excellent resource to get some of that information. So what are some general talking points and tips? If you're having conversations with people in the community and they start talking about these rumors or misinformation that you're really kind of unsure about, here's some great ideas on kind of how to handle those scenarios. We don't want you just immediately counteracting what they're saying, saying that whatever they're saying is untrue. Because the fact is, there's a little bit of truth in everything. You have to be able to disseminate through that information and present your case with empathy, so that you understand where they're coming from, but you slowly direct them into a different thought process. So you can say, I don't know that to be true. Would you like to talk to someone more knowledgeable about this concern? You could say, that's an interesting point. I've not heard that before. Would you mind sharing your resource so we can look into that? That is a great empathetic response because it's saying you're not agreeing with them, but you're also not immediately just disproving them if you don't know the information. You're saying, I hear you. I would be scared as well if I've heard that. But can I see your resource so we can look in to see if this is an actual reliable source of information? You can also say that's an interesting perspective. Tell me more about what makes you think that. Where did you hear this? Why do you feel that way? Those are ways for people to kind of talk through their own fears and maybe realize that they are fears rather than accurate information. And some people will just continue to talk about whatever misinformation or rumor that they heard, and you're not trying to win this conversation. You can just say, it's clear that you have strong feelings about that. I'm going to have you talk to someone, a nurse or a doctor, or simply agree to disagree on the particular subject. So again, be respectful, be curious, but do be confident. If someone senses that you're not confident, they're more likely to kind of back you into a corner or to dismiss you entirely. And being confident isn't the same as being knowledgeable or being right. It just means using a confident tone. You know what your next step is and being confident in your decisions. And lastly, maybe most important, it's okay not to have the answer. You're not a team of just one person. You can defer to other members of your team, refer to a person or a provider. You can refer a person to their provider or someone else if you're at a vaccine event that they might have more knowledge. So you can defer, deflect, and escalate it up the chain if you don't have all the answers. I don't want you to just say false information if you don't know that that's also not true. So in summary, the spread of COVID-19 is through direct, indirect, or close contact with infected people via the mouth and nose secretions. Vaccination, wearing a mask, hand washing, social distancing are all effective ways to limit the spread. Certain people are at greater risk of developing more severe illness, and some people have no or very mild symptoms and are still able to spread the virus. And it can be spread even if someone has no symptoms. And then finally, vaccines are safe and effective. We've had many months and even years now of research and studies. Thank you for listening on COVID-19.